Thank you for watching Surviving Breast Cancer in Stilettos. Please like, comment, and subscribe to my YouTube channel. This video is to discuss helpful tips on finding the right doctor and plastic surgeon during your breast cancer journey. So one of the most important things when you're diagnosed with breast cancer is finding the best hospital and the best doctors. Now, ladies, this is not you wanting a pair of Louboutins and you can't afford it, so you went to a different store and got an imitation shoe that looks similar to Louboutin you can't afford. No, this is your life. You have to go to the best of the best. And I know with insurance and not having money for some, it's hard to do. I was lucky that I had insurance, so I was able to go to one of the top hospitals in New York. And it was also because my mom at the time had a friend who knew someone that worked in the hospital, and I was able to get an appointment. So a lot of times having these great hospitals, it's hard to even get an appointment, and sometimes you could be on a waiting list. So I get that. But it is extremely important now as women who surviving breast cancer, even any woman that's watching this video who didn't have breast cancer, to know what are the cancer facilities or hospitals that are top rated in your area. And those are the hospitals you need to go to, and not just any hospital that deals with cancer, because you are a breast cancer thriver, breast cancer survivor, someone who's currently going through breast cancer. So you need to find a hospital that specializes and deals with that and have a certain sector or center in that hospital that deals with breast cancer. I go to Mount Sinai in New York. They have their own breast cancer facility. And it makes a difference because when you go to your appointments, you are surrounded by women that have breast cancer. You are seeing people who look similar to you. You're able to sometimes, before COVID, have conversation with these women. When you call them, they know you're calling about breast cancer. It's not a facility where it's all different types of cancer and you intertwine with all these other people that deal with different cancers. And when they call, like, well, what cancer are you talking about? So it really helps to find a hospital that particularly and primarily deal with breast cancer. And how you do that is Googling. Sometimes it's word of mouth, finding out who you know had breast cancer, where they went to, going to reviews, going to YouTube, doing your research. And I know what you're thinking. Well, Farrah, how am I going to have time to do all that if I just got diagnosed? I don't know where to start. One, you need to find someone who's going to be there to advocate for you, whether it be a friend, a parent, a child, a husband, a boyfriend, a girlfriend, whoever it is. You need to have someone to take on that leadership role and kind of do the things that right now you're not mentally ready to do. So maybe even finding the best hospital in your state or in your area would be something you would delegate to that individual to kind of look, I just got diagnosed with breast cancer. Can you help me? Or can you look what is the top hospital, do your reviews? And once you find out that top hospital, you call and make an appointment. And sometimes well, we don't have an appointment until 2 weeks now. You keep calling. You be very assertive. And sometimes you got to be a little aggressive. Like, I need an appointment. And keep calling and calling, having multiple people call. Because a lot of times people cancel appointments. Something changed. The calendar changed. The doctor sometimes add an extra appointment. So you continue calling until you get an appointment. But also have a backup plan. There are number one hospital, number two hospital. Find your top 3 hospitals. And those are the hospitals that you would continuously call until you get an appointment for the doctor that you need. Now, a lot of these facilities have more than one plastic surgeon or oncologist. So that's where you make your decision. Does it matter who I'm going to? Does it have to be a male doctor? Does it have to be a female? Do you want someone of a particular race? Sometimes, ladies, we can't be picky. You can't be like, well, I want it to only be a woman, where maybe the top rated doctor in your neighborhood is a male. You would have to deal with that. Or I want to go to an African-American doctor. Sorry, a lot of the doctors where you may be located are not African-American. So you would now have to make the decision of who you feel comfortable going to. So it starts out with finding the right oncologist, which will be the person who's dealing with your breast cancer journey, and also the right surgeon. Now, that surgeon is either the person who's going to be doing the double mastectomy or the person that's going to be removing the cancer from your breast or wherever else is located, like maybe a lymph nodes. It is extremely important Again, let me repeat, it is extremely important that you find a great, not good, not subpar, but great plastic surgeon to do your surgery. Because this, ladies, is the doctor slash surgeon who is going to be leaving that permanent scar on your body. Okay? So if you're getting a mastectomy, this is the doctor that's going to be doing the initial removal and the initial scarring. So you need to make sure you find the right doctor, surgeon. So you don't need to find any other surgeons to fix whatever they messed up. So in order to find that great surgeon, you will have to do research. Now, everyone is different because you may have to do chemo and then surgery. Some people have to do surgery and then chemo. So you have limited time to actually find the right surgeon for you. I was lucky once again because my surgeons and oncologists was in the same hospital. So I was able to have all the great doctors one place. So I didn't have to search, which is also extremely important, ladies, that when you are finding the right oncologist and the right surgeon, that they are in the same hospital. Don't have your oncologist one place and have your surgeon somewhere else, because that's not going to work out well, because the files and the testing and the communication between the doctors may not always be in sync, because one hospital's this place, the other hospital's there. And you also want to make sure you can do all your appointments one place instead of, oh, I have an appointment over here, there, and I have an appointment here, there. It's just too much. So try to have everything one place. So with the surgeon, this is what I did, and my doctor offered it, which means all your surgeons should be able to offer you the same thing. One, I had a surgeon, rest in peace, he passed away a year while he was doing my reconstruction. However, the first thing he told me was, let me show you pictures of my work. Ladies, that is the best thing your surgeon could tell you. That one lets you know he is proud of his work. Two, he wants to build that relationship with you so you can trust in him and believe in him that he's going to do good work. So when he said that, I didn't even think about, because I was going through so many things, I honestly didn't want to see any pictures. But when he said it, I was like, oh, wow, you have pictures? He showed me pictures. I saw the scarring, and I was like, oh, okay, it doesn't look so bad. And not only did he show me pictures, he offered to give me numbers of other breast cancer women that he worked on that I could talk to. I was like, oh my God. He was so confident in his work. So I actually did. He had scheduled an appointment for me to meet one of the women that he did his work. He did her breast, and I met her. She came in there. She was like, woo, look at my breast. I am so proud of what Dr. Chin did with my breast. Oh my God, look at it. And it made me feel comfortable. She went on and on, talked about how great he was and how he did her implants and he was one of the best doctors ever. So that made me feel comfortable going into surgery, because one of the main things we worry about, ladies, is what are we going to look like after? That's true. Like, how is it going to look? How's the scarring? How's the healing? So once I saw what it looked like and met women that actually he worked on, I wasn't surprised on what I was going to see. When I looked at myself, I was like, oh, okay, these are pictures I've seen before. I saw a person face to face with those scars. So it wasn't shocking. I know we could go on YouTube and Instagram or Google and see pictures of these things. But when you actually see it naturally and you hear someone he actually worked on, it helps. So I would suggest to you, when you find the surgeon that you think you want him to have surgery on your breast and scar you, and it is a scar that's going to be there for life, you need to say, do you have any pictures? Do you have any of your prior patients that I could speak to? Now, if he says no, you need to second guess that person. You need to second guess, because all great plastic surgeons have work. It's like you're an artist. You want to show your work to other people. So if he says, no, I don't have any pictures, oh, I don't have any patients that you can actually speak to, something's wrong. Because as we all know, as breast cancer survivors, thrivers, and we doing it, we are always open to speak to other women and educate other women and support other women. So if he said, no, I don't have any patients that you could speak to, that is a problem. That, to me, is not the plastic surgeon you need to work on your breast and give you implants and do a double mastectomy or do anything to your body. Because right now, to me, if someone said that to me and he's gonna be my plastic surgeon, I would think he's not proud of his work and he doesn't want to let me speak to any of his patients because they're gonna complain about him or her. So that is one of the main things you could question your surgeon about, and that would definitely let you know, is he or she the right person for you? For picking the right oncologist, the best thing to do is also see if you can speak to a previous patient or current patient, and definitely doing your research. Now, with an oncologist, this is a doctor that diagnoses your cancer, that tells you what kind of medication they're going to give you. That's a doctor you call if you have any side effects with the medication. So there's no pictures. However, you could definitely speak to a current patient or a previous patient just to find out what is the bedside manner of this oncologist. When I call, is this oncologist calling me back? Is this oncologist sympathetic to some of my needs and concerns? So that is what a current or previous patient will be able to answer. Also going on Google and looking at the reviews. I particularly like speaking to an actual patient because on Google, I feel like anybody can leave a review and sometimes you don't know who's leaving these reviews. So it's always good to actually speak to an actual patient. Now with the oncologist, it's sometimes best to get more than one opinion because that is their diagnosis, prognosis of your cancer. So always getting a second, third opinion is always a good idea. Now, in the beginning, you may not have the time to do it, and that's fine. But once you start your treatment and you feel like, oh, I've been doing this, or you're seeing even more complications, whatever issues, and you feel like I need to get more than one opinion, do it. So I did it, and my suggestion to you when you're getting a second opinion, try to get it from different types of doctors. And when I say different types of doctors, I'm speaking about oncologists. If you're currently seeing a female oncologist, if you're getting a second opinion, get it from a male oncologist. Just see different perspective, different ways how they were treated, different types of treatment they will possibly give you. If you're now seeing African-American oncologists, your second opinion, I would see maybe an Indian or Caucasian oncologist. So with me, I got 3 different opinions. Second opinion, third opinions. My first oncologist, she's female Indian. My second opinion was a Caucasian woman. And my third opinion was an African American male. And they all said the same thing. This is the medication you need to take. This is the type of cancer that you have. And this is the outcome. This is what could potentially happen if you start your treatment. So I did that because I wanted to feel comfortable with who I'm currently seeing and making sure that she is doing the right thing. She had the right medication for my type of cancer, and that whatever she saw forthcoming with my treatment was accurate. So that's why I got 3 opinions, but it was throughout my journey. It wasn't like the first year because there was so many things going on. So I would say maybe 2 or 3 years after I got a second opinion. Then when the cancer came back, I got another opinion. So that actually made me feel comfortable that a doctor I'm currently seeing, I know 2 other doctors, different genders, different sex, different nationalities, were able to say, you know what, she's doing the right thing. So ladies, we need to do a lot of research. We need to figure out what we need, what we want in our doctors, and try to get. We're not going to get everything from our doctors. Like my doctor is great, but when she gives me test results, she may not be the best person to call me right away. You're not going to find the perfect doctor, but you need to start making a checklist of what you want from your doctor and trying to ensure that the doctor you're currently seeing have those things, or finding a doctor that do have those things that you feel on your list is currently important. So ladies, thank you for watching my YouTube channel, Surviving Breast Cancer in Stilettos. Stay tuned for more videos. If you want to catch me live, follow me on my Instagram page, SurvivingBreastCancer_. Bye. Please click the notification button for upcoming videos.